Hi there, my name is Sam Razi. I am the founder and editor of the website hairlossfight.com. It is a consumer hair loss information and news site and forum that has been in existence since about 2003. And we're really happy to be here at the Alvi Armani Hair Restoration Clinic with Dr. Baubac, who heads the clinic. Thank you for having me here to do this interview. Very much appreciated. I think it's very important today in the environment of what can be done to treat and deal with hair loss, to provide people with really useful information so they can make consciously good decisions when they go out and deal with their hair loss. And I think, Doctor, you know how negatively hair loss can impact some people in terms of their self-confidence and how they cope with their lives after they're impacted with it. So you know what you do is obviously important work, and there's a lot of people now that are a lot of clinics out there now that are doing all sorts of work. And one of the things that I think is important, and I want to do with Hair Loss Fight, is to showcase clinics that I think are sort of above the grade and doing good work. And you know, certainly the photographs I've seen, some of the patients of yours that I've interacted with, I've seen have had really amazing work done. You can't even tell along the hairline.
Right, it's a pleasure to have you here.
Thank you.
And thank you for the opportunity. Hair loss has been a fight, a battle that's been fought for many, many years. Research indicates that the field really started back in the Renaissance era with the work of Da Vinci off of the book De Architectura. And this laid out how the facial framing of someone should be. Specifically, they referred to hair loss and how it impacted the symmetry of the face. And additionally, it also spoke at where the nose should be, where the facial features should be. It has been a battle, and we're gaining inches on it with the technology that has advanced thus far. Now, more than ever, patients have so many options to choose from. We are certainly happy to be one of their options.
Dr. Baubac, how long have you been doing specifically follicular unit extraction hair transplantation procedures?
That's a great question. In Alvi Armani, we began our practice in 1999 doing the strip procedure. We began research on FUE in 2000. At that point, we were only able to do about 150 to 200 grafts per day. Our R&D department was able to advance that to a degree where we transitioned to a hybrid sort of a technique in 2006,
Okay.
where half our procedures were strip, the other half were FUE.
Okay.
And in 2007, we completely converted to FUE and have been using that harvesting method exclusively since then.
Okay, very good. So you've obviously done many procedures.
We've done a lot of procedures, and we've had the privilege of working with a lot of amazing patients from all parts of the world. Different hair characteristics, different skin, different personalities, and it's been a tremendous advancement thus far in this field for harvesting.
Indeed, because you no longer have the strip, which I think is preferable, not having the scar. So a lot of people are now, you know, looking to get FUE procedures done exclusively. They don't even consider getting a strip, and they're traveling, you know, to outside of the country and going to clinics potentially in, you know, countries like Turkey and whatnot. What would you say sets your clinic, your practice, apart from those types of clinics where potentially the cost is maybe a little bit lower? Mm-hmm. You know, and it's delicate work, FUE. So what really sets you apart from other clinics, as it were?
FUE is delicate. I consider the design and the artistry behind the procedure probably the most critical. FUE is a harvesting technique. To be able to do a transplant, you need to have your donor tissue. The procedure itself is an orchestra of detailed work. It's a process you cannot cheat. If you do cheat, you cheat the results. Quite honestly, I'm not sure what other clinics do. And I involve myself with the work that we do here, and that's where all my focus is. But certainly, I tell all our patients to do research and to follow logic. The procedure needs to be done in a specific manner, and price should be only a small consideration. When you're looking for a lifelong investment, something that could be quite transformative. It has been for a lot of our patients. I've had the privilege to see that and the impact it can make on them. And so to those who are looking to embark upon this procedure, first I say do as much research as you can. And sites like yours, which project an objectivity that sometimes is lacking when folks are trying to do research, really are helpful in steering patients the right way. And so the final decision needs to be an informed one.
Indeed.
And price should be one of the considerations, of course, but also this is something that could be permanent, that should be permanent, and it could be permanently good, and I've seen it could be permanently damaging and scarring not only to the scalp but to the psyche. And so there is a certain minimal standard that needs to be followed in this procedure, and the hope is that everyone is following that. Unfortunately, we do see examples where they are not, and so an informed decision must be the only way that a patient must look before taking on such a critical procedure.
Indeed, indeed. Are you yourself doing the harvesting of the grafts, or are you using technicians to do it?
I feel very strongly that this is a procedure that involves a lot of artistry, and certainly it's also an arduous, very long procedure. You need to keep focus for long periods at a time. It's my preference that myself and our surgeons do the harvesting themselves. In fact, in the United States, no technicians should be doing any harvesting, although sometimes I have heard of that.
Right.
And certainly in Canada, I'm not sure what the rules are, but this is something so intricate, and your donor region is not infinite. You have a finite number of grafts, and
right.
every single graft should be impactful, should be used efficiently. In harvesting, to get 3,000 grafts should not be that difficult now with the technology and the recent history of FUE and its advancements. However, the question that one must ask is, how many grafts does it take to get 3,000 grafts? What is the accuracy of the harvest? What is the percentages that an accurate harvest can obtain? A patient may have 8,000 grafts. In an inexperienced hand, all those 8,000 can be chewed up to get 2,500 to 3,000 grafts. But with experience and with focus, those 8,000 grafts can yield 8,000 grafts, and that can be obtained. And for a lot of patients, that would be more than sufficient to conceal and cover and give them the style and facial framing that they desire, to transform them in the manner in which they see themselves. And so harvesting is only one component of the procedure, but here we like to have our own hands on our patients and have the ultimate degree of focus. And then we surround ourselves with an amazing team. The most skilled of our technicians make it to our team, and they are extremely humble, skillful, and love what they do, as do I. So it's that combination that leads us and myself to really want to involve myself in the harvest of the procedure, and it's really an art form when you can do it at a high level.